simulation center is different than the clinical setting because you get the chance to be right next to your instructors. And if you have questions, it's easy for you to ask them. You also get them to in a good position to observe you the entire time. So I think it's just a good learning experience for us, and also a good opportunity for them to see us use our skills.
Walking into these rooms, you're thinking, oh wow, so this is what it's going to be like when I step foot into Mercy. And so just the familiarity was great.
The reason that we decided to build a simulation center is that it's become really the industry standard for healthcare training. All the programs in Iowa either have simulation centers or are moving that direction. The research is pretty clear that students that participate in simulation achieve at a higher level.
I think the piece of being able to pre-brief before the simulation has given them an increased ability to critically think. And when we get into the clinical setting, they're able to critically think that much faster now because they practiced that.
The Health Simulation Center will provide you an opportunity to practice your skills and integrate them into a very realistic healthcare experience. The simulators have the potential to have a cardiac arrest, for example. That may not come up very often in clinical practice. And certainly it isn't something you want to do the first time, unprepared.
When we're doing the simulation, we're kind of given the little surprises here and there so we can challenge ourselves a little more. And when we watch the video, we know exactly what we have done wrong, what we have done right, and makes it very rewarding when you watch it and figure out what you need to do or not to do.
I think it was a great decision to go into the healthcare field with the simulation center. It makes you feel a lot more comfortable working, being in the sim center, doing simulations. You feel better prepared going to a clinical setting.
In doing further research, the National Council for State Boards of Nursing actually conducted surveys and studies to show that we could use simulation activities in lieu of clinical hours, clinical placement, and still have the same type of outcomes on NCLEX that we did as if the student were participating directly in clinical practice. We also know that studies have supported, as a part of this National Council study, retention, critical thinking is increased, and obviously we look at the fact that a student is more comfortable and more competent when they enter the clinical setting.
I think you see a variety of centers. Some are integrated with actual hospital settings. Others are kind of standalone one-room simulators. What I think makes this one special is when you walk in the door, you really get the hospital clinic feeling about it. And our director's done an excellent job trying to create an environment where we have children, we have adolescents, we have adults. It allows us in our four-room setting to really address a lot of healthcare needs at a lot of different ages.